Hello everyone. Today we are going to study the lesson of non-suppurative osteoarthritis. Now it's the three parts that I would like to tell you. The first is osteoarthritis. Second is ankylosing spondylitis. The third is rheumatoid arthritis. The osteoarthritis is a degenerative disease due to aging, obesity, strain, joint trauma with articular cartilage injury. The main clinical symptom is as follows. They are pain, joint swelling, tenderness, muscle atrophy, joint deformity. The accessory examination mainly is the X-ray. You can see the joint space narrowing, osteophyte formation, a deformity, subchondral sclerosis. And the treatment should be the general treatment. That means to reduce the joint weight and excessive activity, etc. The medication should be the anti-inflammatory analgesic, the intra-articular injection, the surgical treatment. That means we can use the artificial joint replacement. Now, the second part is ankylosing spondylitis. Ankylosing spondylitis is a kind of disease which is mainly caused by the inflammation of the sacroiliac joint and spine. We can short for AS. AS is a category of rheumatoid arthritis. It's a kind of seronegative. Now look at this picture. It's the man who suffered from the serious disease of AS. That's a long period of time. The X-ray, you can see the mainly 98% to 100% cases of early stage of celiac joint X-ray change is an important basis for the diagnosis of this disease. You can see the sacroiliac joint narrowing, the bamboo spine change, the femoral head necrosis, and hip fusion. Now look at this picture. This is the bamboo spine in ankylosing spondylitis. So the clinical symptom is easy to occur in 16 to 25 years of age youngs. Men accounted for 90%. They should have a family history. And the sacroiliac joint and the lower back pain, the sacroiliac joint percussion pain, and spinal stiffness, deformity, and the joint movement disorder. The treatment should be relieve the pain, prevent deformity, osteotomy, and prosthetic replacement. Now, part 3 is the rheumatoid arthritis. We can short for the RA. RA is a kind of unknown etiology of chronic systematic disease with inflammatory synovitis, which can lead to the joint deformity and dysfunction of the movement. The main symptoms should be joint pain, swelling, morning stiffness, multiple joint involvement, the limitation of activity. Now look at this picture. This is the swan neck deformity. The fingertip just like a swan. So the actual articular manifestation should be fever, rheumatoid nodules, anemia. Anemia is the most common manifestation of RA, and the cardiac involvement. The laboratory examination should be the hemoglobin decrease, and WBC also decrease, and RF should positive, and the ESR increase, and the CRP increase, and the IgG, IgA, etc. also increase. And diagnosis. The RA classification standard of American College of Rheumatology. There are basically 5 points. The first is morning stiff of head joints at least 1 hour, the symmetry of arthritis, the rheumatoid subcutaneous nodule, the X-ray changes, the serum rheumatoid factor is positive. The medication should be 3 points. The first is NSAIDs. The second is immunosuppressant. The third is corticosteroids. And the second is the most important is the surgical treatment. We can use the replacement of the joint. Okay, that's all. Thank you, everyone.